Stroke is one of the most dangerous conditions that can occur suddenly and have serious consequences. But did you know that the body often warns us in advance of impending danger? A month before a stroke, there may be subtle but important signs that can be easily missed or dismissed as fatigue. In this video, we'll break down 7 silent signals that may indicate an increased risk of stroke. If you notice at least one of these symptoms in yourself or a loved one, it's important not to ignore them and see a doctor. Remember, early detection can save a life. Sign number 1. Sudden weakness in the extremities. Sudden weakness in one or both limbs is one of the most common signs of an impending stroke. It usually manifests itself asymmetrically, i.e., for example, the right arm and leg become less mobile, while the left side of the body remains normal. This happens due to a partial disruption in the blood supply to the brain. If the area of the brain responsible for movement does not get enough oxygen, the muscles begin to weaken, even if there is no pain or other obvious symptoms. How can you tell the difference between normal fatigue and a dangerous symptom? Weakness appears suddenly, even if the person felt normal before. One side of the body weakens more than the other. For example, the right arm feels woozy and hard to control. The symptom does not go away after rest. If weakness persists for more than a few minutes or recurs throughout the day, it is a cause for concern. Weakness is accompanied by numbness or tingling in the extremities. Real patient stories. Case 1. A woman, 58 years old, noticed a month before her stroke that she sometimes lost her grip. Objects fell out of her hands. She attributed this to fatigue, but 3 weeks later, she had a stroke. Case 2. A man, 65 years old, felt his leg pulling when he was walking up the stairs. 2 weeks later, he ended up in hospital with a diagnosis of stroke. What should you do if you notice this symptom? Check yourself. Try raising both hands in front of you. If one of them falls down, or you have difficulty holding it up, this is a red flag. Write down when and how often the weakness occurs. If the symptom recurs, even if it goes away, see your doctor immediately. Don't put off getting a checkup. Your doctor may perform a vascular ultrasound, MRI, or blood test to detect possible stroke risks. Conclusion: even short-term weakness in the extremities is not just fatigue. It can be a warning of an impending stroke. You need to react immediately. Sign number 2. Disturbance of coordination and dizziness. Dizziness and loss of coordination can be one of the earliest signs of a stroke, especially if they appear suddenly and for no apparent reason. Why is this happening? The cerebellum is the part of the brain that controls balance, movement, and coordination. If there is less blood flow to the cerebellum due to narrowed or blocked arteries, a person may experience instability, uncertainty in movement, and sometimes even a complete loss of spatial orientation. How can you tell the difference between normal dizziness and a dangerous symptom? It comes on suddenly, even if you were feeling fine before. Not related to the position of the body. Unlike ordinary vertigo, in stroke, the symptom can appear even at rest. Additional symptoms: if numbness in the limbs, weakness, sluggishness of speech or vision problems are added to the dizziness, this is a serious cause for alarm. Feeling intoxicated. People often describe this state as like getting drunk even though I haven't been drinking. Real patient stories. Case 1. A woman, 56 years old, felt that she was stormy like on a swing. She thought it was her blood pressure, but 2 weeks later, she had a stroke. Case 2. A man, 62 years old, suddenly lost his balance, hit a wall, and couldn't figure out which way to go. He thought it was just fatigue, but the ambulance found out that he had had a mini-stroke. What should you do if you notice this symptom? 1. Sit or lie down and try to relax. If the dizziness does not go away after a few minutes, this is a warning sign. 2. Try a test. Close your eyes and try to touch the tip of your nose with your finger. If you fail and your hand misses, see your doctor immediately. 3. Note if there are additional symptoms. If you suddenly have trouble speaking, vision problems, or weakness in one side of your body, call an ambulance. Conclusion: if you suddenly lose your balance, feel dizzy or feel groggy for no reason, it could be a warning of an impending stroke. Do not ignore this sign and consult your doctor immediately. Sign number 3. Temporary memory lapses or confusion. Confusion and short-term memory lapses may look harmless, but if these episodes occur regularly, it's a red flag. Why is this happening? The brain needs a constant flow of blood and oxygen. When the small vessels that supply the frontal and temporal lobes of the brain become narrowed, the centers responsible for memory, attention, and concentration are impaired. What can a man experience? 1. It's thought retardation, difficulty making decisions. 2. Inability to remember familiar things, like where your keys or phone password are. 3. Problems with concentration. It is difficult to keep attention even on simple tasks. How can you tell the difference between ordinary forgetfulness and a dangerous symptom? Sudden onset of the problem. If a person had no memory difficulties before, but now increasingly forgets important things, not related to stress or fatigue. If confusion occurs for no obvious reason. Short-term blackouts. For a few seconds, the person seems to get lost, forgets what he or she was doing. Accompanied by other symptoms: dizziness, weakness in the limbs, difficulty with speech. Real patient stories. Case 1. A man, 67 years old, started forgetting where he put things a week before his stroke. He blamed it on his age, but then he had a microstroke. Case 2. A woman, 59 years old, suddenly stopped recognizing familiar streets, although she had lived there all her life. A month later, she was diagnosed with a stroke. What should you do if you notice this symptom? Make a note of the date and frequency of such episodes. If forgetfulness has become a frequent occurrence, it's best to see a doctor. Take a test. Ask someone to ask you simple questions. For example, what day is it? If it's difficult to answer, it could be a warning sign. Pay attention to additional symptoms. If forgetfulness is accompanied by dizziness or weakness in the hands, see a doctor immediately. Conclusion: if you start to forget simple things, lose the thread of conversation, or experience confusion for no reason, it may be a warning sign of an impending stroke. Don't ignore these signals. Taking action in time could save your life. Sign number 4. Sudden changes in vision, blurred, split, or loss of peripheral vision. Visual disturbances are one of the most subtle but important signs of pre-stroke. They may appear weeks or even a month before the stroke. A person may experience temporary visual impairment that seems minor at first, but recurs with increasing frequency. This occurs due to impaired blood supply to the visual centers in the occipital lobe of the brain or the eye nerve. With a lack of oxygen and nutrients, nerve cells begin to work worse, which leads to the appearance of visual abnormalities. What kind of vision problems can occur? Blurred vision. Suddenly it feels like looking through fogged glass. It is difficult to focus on text or objects, especially up close. A haze or fog seems to appear in front of the eyes. Double vision, diplopia. Objects appear binary even if the person closes one eye. May occur briefly and disappear, but then recur, often accompanied by headache or slight dizziness. Loss of peripheral vision. The person does not notice objects on the sides as if looking through a narrow tube. May bump into furniture without noticing it from the side. Drivers begin to see cars in their rearview mirrors worse. Temporary or partial loss of vision in one eye. It feels like the curtain is coming down in front of one eye. The field of vision on one side is lost for a few seconds or minutes, maybe accompanied by a mild headache or a feeling of pressure in the head. How can you distinguish between temporary visual disturbances and a serious symptom? 1. The onset of symptoms is sudden and unexplained. 2. Vision is impaired in only one eye or in one part of the visual field. 3. The problem is not related to eye fatigue or long hours working on the computer. 4. Symptoms recur even if they go away on their own at first. If at least one of these points coincides, it is worth immediately contacting a doctor. Real patient stories. Case 1. A woman, 61 years old, noticed that she sometimes had a blurred image as if she were looking in a crooked mirror. 3 weeks later, she had a stroke. Sign number 5, sudden dizziness and loss of balance. Dizziness and loss of balance are some of the symptoms that can easily be attributed to fatigue, lack of sleep, or getting out of bed. But if these episodes are recurring, you should be wary. They can appear weeks or even a month before the stroke, and at first they seem insignificant. The main cause is a problem with the blood supply to the cerebellum, which controls our coordination, balance, and orientation in space. When the brain is deprived of oxygen, signals are delayed, causing the person to feel suddenly unsteady, dizzy, or unsteady. What kind of sensations might arise? 1. Sudden dizziness without cause. Suddenly it feels like the ground is falling away from under your feet. You feel dizzy, even if you are just sitting or standing. It feels as if the world around you is shaking or moving. 2. Balance problems and unsteadiness when walking. The legs suddenly become cotton, and it becomes more difficult to walk. The person starts to stumble, although the surface is flat. Unexpected feeling of unsteadiness when standing up or climbing stairs. 3. Loss of orientation in space. A person gets lost in familiar places, suddenly forgets where he or she was going, may take a wrong turn even if he or she is following a familiar route. Sometimes there are difficulties in estimating distances, e.g., missing a doorway or accidentally hitting furniture. 4. Feeling like you're about to pass out. Your eyes darken sharply, as if a wave has come over you. You feel as if you are about to faint. You may completely lose consciousness for a few seconds. How do you realize that dizziness is a red flag? It occurs suddenly, for no apparent reason. The condition worsens sharply, even if the person just sits or stands. It is accompanied by weakness, numbness, or difficulty speaking. Sometimes it is difficult to speak or move your arm. Recurs more and more often, even if it goes away quickly at first. Episodes become regular and occur even at rest, not associated with sudden movements or standing up abruptly. No habitual association with change of body position. If at least one of these points is familiar to you, it is better not to postpone a visit to the doctor. Real patient stories. Case 1. A man, 62 years old, noticed that from time to time he was pumping as if he was drunk, although he had not been drinking a drop. 1 month later, he had a stroke. Case 2. A woman, 59 years old, fell down several times in a month on an even place. Doctors diagnosed a circulatory disorder in her brain. What should you do if you experience these symptoms? Pay attention to how often it happens. If the dizziness has become regular, it is a warning sign. Check your coordination. Try to walk in a straight line without wobbling. If you can't, it's time to be alert. See your doctor right away if dizziness is accompanied by weakness, numbness, or speech problems. Conclusion: if you suddenly feel dizzy, wobbly, or feel like you are losing your balance, it could be an early sign of a stroke. Do not ignore these signals. Timely treatment can save your life. Case 2. A man, 57 years old, suddenly realized while driving that he could not see well in the side mirror. A month later, he was diagnosed with a cerebral circulation disorder. What should you do if you notice this symptom? The first thing to do is to check your vision. Try looking around with one eye closed and then the other. If your vision is worse in one eye, this is a worrying sign. Also, don't ignore temporary deterioration. Even if vision is restored after 10 minutes, it is important to record the episode. See an ophthalmologist and neurologist right away. Visual disturbances can be a precursor to a stroke. Conclusion: if you have recurrent problems focusing, blurred vision, double vision, or sudden loss of vision, it could be an early sign of an impending stroke. Don't wait until symptoms become serious. Timely diagnosis can save a life. Sign number 6. Unusual headaches. Headaches are a common problem, and most of us deal with them on a regular basis. However, unusual and severe headaches that come on suddenly and are unlike anything you've had before may be a precursor to a stroke. They are often accompanied by other symptoms such as nausea, vomiting, speech, or vision problems. These pains can be sharp and intense, sometimes described by the person as the worst headaches of my life. The cause of these headaches is a possible disruption of blood circulation in the brain. This may be due to ischemia, lack of oxygen, or inflammation of blood vessels, which leads to painful sensations. What kind of sensations might arise? 1. Sudden, intense headaches. Suddenly, there is a sharp pain that occurs without warning. This sensation can be either a throbbing or a pressure in the head. It starts to hurt your head, even if you are just sitting or standing. Sometimes the pain feels like a lightning-like jolt to the head that doesn't go away or lessen even when you take painkillers. 2. Painful sensations in the back of the head or temples. The pain is centered in the back of the head, neck, or temples, and may get worse when you move your head or even change your body position. Light and noise can make the pain worse. 3. Headache accompanied by other symptoms. In addition to pain, nausea or vomiting may occur. Speech problems are common, and people may have difficulty speaking or forming words into sentences. Visual disturbances such as double vision or blurred vision may occur. 4. Pain that doesn't feel like a regular headache. This pain comes on suddenly and is very intense. It does not go away after a few hours and is not relieved by standard painkillers. It is not the usual migraine or tension pain you have experienced before. How do you realize that a headache is a red flag? It comes on abruptly and without warning, not like a regular headache you're used to. The pain is very intense and does not decrease even when taking painkillers. Accompanied by other symptoms such as nausea, weakness, speech, or vision problems. The pain persists for a long time and does not go away after a few hours or days. If any of these points match your condition, it is worth seeing a doctor immediately. Real patient stories. Case 1. A woman, 48 years old, felt a sharp headache that came suddenly, like a lightning strike. Speech problems soon began, and she was hospitalized with a stroke a few hours later. Case 2. A man, 55 years old, suffered from an unusual headache that persisted for several days. He did not pay attention to it until he began to notice loss of sensation in his arm. 2 days later, he had a stroke. What should you do if you get a severe headache? Don't ignore sharp, severe pain, especially if it is different from your usual headaches. Monitor for other symptoms. If the pain is accompanied by nausea, vomiting, or speech problems, seek medical attention immediately. Taking painkillers will not always solve the problem, unless it is a regular headache. So go to the doctor right away, especially if the pain does not go away. Conclusion: if the headache comes on suddenly, is severe, and does not go away, it may be a precursor to a stroke. Do not delay a visit to the doctor. Early diagnosis and treatment can save your life. Sign number 7. Tingling or numbness, paresthesia. One of the warning signs of a possible stroke is numbness or tingling, which most often occurs on one side of the body, in the arm, leg, fingers, or face. This symptom may develop gradually, becoming more and more pronounced. What can it feel like? 1. Numbness. The limb feels foreign and does not respond well to touch. 2. Tingling. A feeling like goosebumps running across your skin. 3. A burning sensation or mild pain for no apparent reason. 4. Loss of sensation in fingers or entire limb. Why is this happening? 1-A stroke disrupts the blood supply to certain areas of the brain responsible for sensation. 2. If the left side of the brain is affected, numbness manifests in the right side of the body, and vice versa. Third, numbness may appear weeks before the stroke and get worse over time. When is this a cause for concern? 1. If numbness or tingling occurs only on one side of the body. 2. If it is difficult to move your fingers, arm, or leg. 3. If the numbness persists even after changing body position. 4. If it is accompanied by dizziness, weakness, or speech impairment. Important: if there are other symptoms of stroke, speech impairment, coordination, severe headache, you should see a doctor immediately. How to distinguish from less serious causes? Sometimes the numbness may be due to causes other than stroke. 1. Staying in an uncomfortable position for long periods of time. 2. A pinched nerve, e.g. with osteochondrosis. 3. B vitamin deficiency. 4. Stress and anxiety. But if the numbness does not go away, appears suddenly, and is not related to physical activity or posture, it is an alarming signal. In such a case, it is better not to postpone a visit to the doctor. Conclusion: now you know the 7 early signs of stroke that can occur up to a month before an attack. If you notice unexplained weakness, frequent headaches, speech or coordination problems, don't ignore these symptoms. It is better to be reassured and see a doctor than to miss the moment when serious consequences can be prevented. Health is in your hands. Share this video with your friends and family. Maybe this information will help someone to recognize the dangerous signals of the body in time. Take care of yourself, stay healthy, and see you in the next videos. Subscribe and like!